needs to be treated immediately, or sometimes the eye may need to be removed. Anytime we get a new diagnosis, it can be scary and a little overwhelming. And I think cataracts is one of those diagnoses that a lot of people dread, because I think most of us realize that at some point we're going to be told that we have cataracts. And that's the simple fact of the matter, is that everyone will get cataracts if we live long enough. So it's just a matter of when and how you deal with it. And today I'm going to try to clear some things up around the diagnosis and the preparation for surgery, and hopefully give you a little bit of comfort going into it. There are actually a lot of different types of cataracts. You may have heard of congenital cataracts or the beautiful Christmas tree cataracts, but today we're going to be focusing on the cataracts that get diagnosed later in life that prompts a doctor to tell you, hey, you have cataracts and I think it may be time to consider cataract surgery. The truth is, cataracts develop very slowly over the course of our lifetime. If you think about it, we really start aging the moment we're born. It's just that these changes don't become too obvious to us until later in life. While most patients in the US won't start hearing about their cataracts until their 60s or 70s, cataracts actually start developing very slowly over time. The lens in the eye, which starts out clear, unless of course you're born with congenital cataracts, starts to become more cloudy. And that's because the proteins in the lens, which are supposed to be parallel in order to let the light through, start to clump together and the lens becomes kind of yellowed and cloudy, making it difficult to see through. You can really start to see these changes starting in the 40s. The lens gets slightly yellow, but the patient doesn't notice it. It's really no big deal. But it tends to start to affect vision in the 60s or 70s. When the lens becomes yellowed and cloudy enough, it starts to affect the clarity of vision. And what I hear most from patients is that they're having trouble with their nighttime driving. They feel like there's a lot of glare and they just don't feel confident or safe driving at night anymore. But in some cases, people will complain first about difficulty reading or trouble seeing far away as clearly as they used to. The lens of the eye is located behind the iris, the colored part of the eye. Now, I think in a lot of movies or TV shows, people get confused because I hear people refer to cataracts and then they have this large white area on their cornea, or they have this kind of whitish deposit around the edge. But that's actually not what a cataract is. In fact, most people, when they're diagnosed with cataracts, you wouldn't be able to tell just looking at them that they have a cataract because these changes start out quite subtle. But if a cataract goes untreated for usually many decades, it becomes white enough that when you look through the pupil, especially with certain reflections of light, you'll notice that there is a whitish appearance through the pupil. I want to focus on the three main types of cataracts that would bring a patient in later in life to see their doctor. One of them is called a nuclear sclerotic cataract. In a nuclear sclerotic cataract, it tends to be more of a diffuse whitening or yellowing or clouding of the lens. This is typically considered to be age-related. It's just something that's naturally going to happen over time. Another type of cataract is a cortical cataract. These look like whitish spokes starting at the edge of the lens and pointing towards the center. These tend to cause more of that complaint of glare earlier on. And if one of the spokes ever crosses over the center of the lens, those people are definitely going to be complaining. We tend to see cortical cataracts in people who have diabetes, especially if their diabetes is not well controlled. And that also means that we can see this occur a little earlier in life than maybe the age-related nuclear sclerotic cataract. Finally, a posterior subcapsular cataract is located more towards the back of the lens and in the center. These tend to happen in people who are a little younger than the other cataracts, and they tend to be related to a history of corticosteroid use, as well as sometimes a history of illicit drug abuse. But in some cases I've noticed them happening and there doesn't seem to be too much of a reason that we can pinpoint. This type of cataract, because it's located in the center of the lens, really tends to bother people. Because of the way the lens functions when we look at various distances, people tend to notice this becomes an issue more with their reading. And this type of cataract almost seems to change overnight. It just develops very quickly compared to the other kinds of cataracts. Sometimes I've seen people and I point out to them that they have this type of cataract. They haven't really noticed it yet. I give them a heads up about the symptoms of this type of cataract, and sometimes they're calling me back within a month. You can have one of these cataracts, or really a combination of all three is possible. But if you have these cataracts present, it may be time for cataract surgery. Some people can be totally caught off guard by the diagnosis of cataracts because they may not have any symptoms at all, they may be fairly young, and it might not even be on their radar. This is where, for doctors, we kind of have to reach a balance of what I like to call share versus don't scare. Some people really like a lot of information about their health, and a lot of offices have a portal that you can access your exam notes shortly after the exam. So I think for some doctors, we want to inform patients of a little bit of everything we see just so that they know, so that when they review the report, they're not looking and seeing that there's some sort of comment about their lens or a cataract that the doctor didn't even mention. Because imagine you go and you review your record and it says cataract and your doctor didn't say a thing. A lot of people would be really alarmed by that. Why didn't they mention that to me? But that leads us to the flip side of don't scare. A lot of doctors may not share with a patient that they have the start of a cataract because they are young, and the doctor knows from their experience and the way that the cataract looks that it's probably going to be decades until it actually becomes a problem for that patient. So do you want to mention it and possibly get them, really concerned and thinking about it all the time and giving them some sort of existential crisis? Or do you just want to put it in your notes and monitor it because you know that it's not going to be a big deal? This is the line that doctors really have to walk a lot. And that's one of the reasons I wanted to make these videos, to kind of try to close that gap and ease this communication difference that can sometimes happen between doctors and their patients. If you received a cataract diagnosis, there's kind of two different ways it could go. Maybe you went into your appointment and you didn't have too much of a complaint of your vision improved with an update of a glasses prescription, and your doctor sees cataracts, but they don't seem to be too concerning at the moment. So you may be somebody who perhaps it's going to be decades before the cataracts become a problem, or maybe your doctor says, hey, your cataracts look like they might be getting ready for surgery, but you really don't have the complaints of glare with night driving or trouble seeing when you're reading, trouble seeing far away. You don't actually have a complaint that points to you needing a cataract surgery. So why go through it if you don't need to? In that case, your doctor may continue to monitor you annually, or maybe if they think it's getting to be pretty close, they'll set you up for a 6-month cataract evaluation. Or perhaps they'll kind of leave it in your hands and say, let's set you up for next year, but call me if things are changing. All of these scenarios are perfectly reasonable. Let's say on the flip side that you did come in complaining about your vision. Even with updating your glasses prescription, your vision doesn't seem to be getting all the way to 20/20, and your doctor really thinks that the cataracts are the cause of the reduced vision and that it may be time for surgery. Well, there are a number of things that are going to happen over the course of the next couple of weeks or months as you prepare for cataract surgery. The preparation for cataract surgery can really vary depending on what sort of clinic you're in and a lot of different factors. So for example, maybe you saw an optometrist at an optometry clinic and they're going to need to refer you to an ophthalmologist who is a cataract surgeon, and that ophthalmologist is probably going to want to do their own cataract evaluation with their own sets of tests to corroborate what they've seen, because maybe they haven't worked with that optometrist before and you can't just go straight into surgery without having looked at an eye first. In other settings, maybe you saw an optometrist who works closely with an ophthalmologist. There are some cases like this where these doctors have a very close relationship and the optometrist does a lot of the preparation, the pre-op examination, pre-operative testing, and sometimes they even walk you through all of the lens implant options, which we're going to talk about in a different video because that's a whole nother thing. They may prep you all the way up until the day of surgery, and the ophthalmologist will just be there for the surgery itself. And the optometrist may see you for the post-operative exams as well. A third scenario is that maybe you've been seeing an ophthalmologist from the get-go, and they're a cataract surgeon, and they have been monitoring you for a while, and they know that your cataracts are ready for surgery. Maybe you just went in for your annual eye exam, but they know you're ready for surgery. They may be able to skip what's called a cataract evaluation and go straight to additional imaging or testing in preparation for the cataract surgery. There are a number of tests that can be done at a cataract evaluation in preparation for cataract surgery, and the main one is dilation of the eye so that the doctor can properly evaluate the cataract, as well as view the retina for any issues. Sometimes they may also want to do an OCT of the optic nerve if they think there may be glaucoma or possibly some other optic nerve diagnosis. Visual acuity is of course an important test that will be done before dilation, and this tells us where your vision is at prior to surgery. Some people may go into the doctor complaining of a reduced visual acuity or difficulty seeing, things are more blurry, but they might not be to the level that necessitates cataract surgery, kind of in the eyes of insurance more so than anything. So there are a couple of different ways to evaluate that further. For example, if somebody has a lot of complaints but their vision still seems like it's too good, a brightness acuity test can be done. And in this case, the patient is asked to read the letters on the chart while their eye is surrounded by this kind of bowl of light. And if their visual acuity is reduced by this tells us that glare may be more of an issue for this particular patient. And reduced vision due to glare is a perfectly reasonable explanation for having cataract surgery. Now, some people, their vision may be too good across the board on all tests for cataract surgery to be considered necessary. And unfortunately, at least in the US, insurance companies can dictate when they think cataract surgery is necessary, among many other things. But this leaves us with an unfortunate fact that the vision needs to be reduced to a certain level in order to necessitate cataract surgery in their eyes. So in order for your insurance to cover your cataract surgery, your vision needs to be reduced a certain amount. Of course, people can have cataract surgery really whenever they want. It's just a matter of it being covered by insurance. There actually is a surgery called clear lens extraction, where somebody can have their lens removed before a cataract even develops, and someone may choose to do this if they want to permanently correct their vision, not wanting to wear glasses or contacts, and they don't want to go the route of LASIK. This is an option. So the whole purpose of this cataract evaluation with your doctor is to have a discussion with your doctor about the symptoms you're experiencing to make sure that cataract surgery is the right move for you, and to make sure that there's nothing else going on in the eye that could be causing your reduced vision other than the cataract. We definitely want to make sure that the rest of the eye is in the best health as possible going into the surgery, and that if there are any other diagnoses present that cannot be fixed, that we are at least aware and have a proper expectation going into the surgery of what the vision will look like afterwards. There are a couple of other tests that can be done, but they're not always done in order to see how the vision is expected to be after cataract surgery. They kind of help to pinpoint more, is it the cataract that's causing the reduced vision, or could there be something else going on? One of these tests is called laser interferometry, and another test is a potential acuity meter. These tests bypass the optics of the lens and test the patient's vision in a different way. And they can help to tell the doctor what that person's vision would be if their cataract was out of the way. And that also helps prepare a patient for what their vision will be like after the surgery. It really can vary depending on the person, and you should always ask questions about what sort of tests are being done or why they do need to be done, but do please realize that it can really vary depending on the situation, how the doctors and the practice function. The tests that are performed in preparation for cataract surgery have a lot of purposes. Not only do you have a dilated eye exam just to check the cataract itself, remember the cataract is located behind this iris. And if the pupil is small or the iris is more closed up, the doctor's not going to be able to fully see the cataract. So dilation will open up this space so that the full cataract can be evaluated. This is helpful for the doctor to know how to prepare for surgery. The density of the cataract can affect the difficulty of the surgery sometimes. The dilated eye exam is also to ensure that everything in the retina in the back of the eye is healthy. And there may be some images done as well to ensure that everything is as it should be. There are possibilities that it's more than just a cataract that's causing blurring vision. The macula is responsible for the very center of your vision. So if there's anything unusual happening in the macula, it can affect your vision significantly, and it may not be the cataract at all. Some doctors will want to get an OCT scan of the macula to ensure on a microscopic level that it has a normal anatomy. Sometimes this can be helpful in a before and after situation because in rare cases, swelling can develop in the macula following cataract surgery, and it's good to have a before and after image. It's also helpful to know if there's anything else going on in the macula, like macular degeneration, for example, or maybe a subtle little bit of change in the contour of the macula that could be affecting the vision. It's really good to know, not just for the doctor to prepare for the cataract surgery, but for the patient. Because if you go in thinking cataract surgery is going to give you perfect vision, and you find afterwards that it's still almost as bad, and then you learn that you have a macular problem, this can be kind of devastating, and it can make people feel like they went through a surgery for nothing. I mean, sure, the cataract is gone now and that may help a little bit, but it just can be a disappointment. So knowing about the macular health is really important. Also, preparing for cataract surgery, the doctor may prescribe different medications to clear up the surface of the eye. Dry eye can be a serious condition, and a lot of people, I think, kind of poo-poo it, like, no big deal, my eyes are dry sometimes. But from the doctor's perspective, sometimes we can see that the corneal surface is extremely damaged, and a damaged corneal surface really significantly it can affect your vision. Not only that, it can affect the quality of the test that the doctor gets pre-operatively, and it can affect, therefore, the quality of the results of the surgery. If they don't have good data going into the surgery, you don't always have the best output. And the patient, just like in the macular issue, can follow up after surgery and be disappointed with their visual result because of the corneal surface. Don't be surprised if your doctor sometimes prescribes artificial tears leading up to the surgery, or sometimes they may actually recommend that you take prescription dry eye drops for a few months leading up to the surgery. Any of these would be an acceptable approach with the goal of you getting the optimal surgical result. Sometimes if a cataract is extremely dense, this would be somebody who is seeing very poorly and they've known something's been going on for a while. Maybe they didn't have access to eye care, for example. If a cataract is extremely dense, the doctor will need to make sure that the retina is healthy in other ways, because even if you dilate it, you can't look through a really dense cloud. Sometimes a B scan will be used. This is an ultrasound that can help us to see if the retina is fully attached. And this is more so done in people who have very dense cataracts that the doctor cannot properly see the retina through. If there is a retinal detachment, for example, the doctor can prepare the patient for what their vision may be like after the surgery. Maybe that retinal detachment has been there for a very long time and they may really not improve vision at all with the surgery. Or maybe if the patient is in poor health and the surgery is kind of borderline risk at this point anyway, the doctor would then know that putting them through a cataract surgery when it's probably not going to improve their vision really isn't worth it in their particular case. But one thing that they'll do is they'll take an A scan of the eye. From the patient's perspective, this can feel similarly to the B scan or ultrasound. Basically, it tells the doctor important measurements, one for example being the length of the eye, and this helps them to know what sort of lens should be implanted. I think sometimes patients freak out when they hear that they're going to have a lens implant, and they might say that they don't want a lens implant at all. But the truth of the matter is, pretty much everybody who has cataract surgery has a lens implanted in the eye. A long time ago, this wasn't always the case, and people who didn't have a lens implanted had extremely thick glasses for the rest of their lives because The cornea bends most of the light that's coming into the eye, but the lens is responsible for bending about a third of the light that comes into the eye in order to focus it on the retina. So if you no longer have a lens bending the light coming in, you're going to need something else to do it, and that's where a really thick glasses or a really strong contact lens is going to correct the vision. The lens implant will not only prevent the necessity for wearing extremely thick vision correction, but you can also curate it to the person to correct their vision in particular ways. For example, some patients may want a lens implant that can correct their vision at distance and near, and if they're a candidate, there are lenses available to do that. We're going to be talking about different lens implant options in another video because we could go down a whole rabbit hole there, but just know that these lens implants can really be used to correct your vision in a number of ways. And your doctor will likely have an appointment where you can discuss these lens options with the doctor, and sometimes they'll have a very in-depth conversation with one of their technicians that can help to guide you further to decide which lens option is best for you. Remember that while we are talking about the eyes here, the eyes are attached to the rest of our body. So while we're talking about eye surgery, we can't just forget everything else. It's very important to know a patient's overall systemic health as they approach surgery. So depending on other diagnoses that this particular patient may have, the doctor may want to order some specific tests leading up to the surgery, like a complete blood count, blood test, or an EKG to ensure cardiac health. If somebody has diabetes and their blood sugar is way out of control, this is definitely going to need to be resolved prior to the surgery. You want to go in with your best foot forward. Let's talk about the surgery itself. There are a few ways to go about the anesthesia for cataract surgery. For the majority of patients, they are going to be awake during the procedure, but of course, numbed. The procedure itself really takes usually about 15 minutes. And while it may sound so terrifying having an eye surgery while your eye is open, everything is extremely blurry and you don't feel any of it. So it can be very nerve-wracking, certainly for people who do have a lot of anxiety surrounding the procedure, and for other reasons as well. People may go under general anesthesia, but doctors usually like to avoid this because general anesthesia can be really hard on the body, and for such a short procedure like this that doesn't require it in most cases, they like to avoid it if possible. Also, if you're undergoing general anesthesia, the doctor may require additional overall health tests in preparation for the surgery that they wouldn't need otherwise if it was just the topical anesthesia. As far as the surgical prep day goes, you wouldn't be able to eat that morning, and really it's the preparation for the surgery that takes the longest. The day of the surgery itself can be nerve-wracking, as of course it can be with any surgery, but know going into it that you won't be able to eat anything, that there's going to be a few hours before the surgery itself where you're being prepped ahead of time, but usually the surgery itself only takes about 15 minutes. And that day you'll go home with an eye patch and some post-operative drops in most cases. Sometimes post-operative drops can be skipped because they can actually inject the medications during the surgery that they would be giving you in drop form. But I have seen this done very rarely. For the most part, patients will go home with some sort of protocol for instilling eye drops that will help to prevent inflammation and infection, and these are incredibly important in the long run to make sure that there are not any complications regarding the surgery that will affect vision, and of course, preventing infection is paramount. It really depends on the doctor how these drops are dosed, so I don't want to go over that because it really can vary, including the types of drops that are used and the length of time that they're given, but usually it's about over the course of a month. And some drops are recommended to be used a certain number of times a day and then they stop suddenly. These are usually antibiotic drops because once you get past a certain point, infection is no longer a possibility, whereas drops that are preventing inflammation are sometimes tapered over time. So it's really important to pay close attention to what your doctor's instructions are. They may have you, for example, take drops 4 times a day for a week, then 3 times a day for a week, then 2 times, then 1 time, and then stop. And if you stop these drops too early, you can get rebound inflammation, and there's just different complications that can occur. So really do your best to follow your doctor's instructions, and if you do not understand them, please ask. We would so much rather answer your questions and help you feel comfortable than have to manage some sort of complication and be worried that you're not going to get the visual result you were hoping for. Often post-operatively, doctors will follow up with the patient for about a month, and these appointments can really vary. Sometimes, for example, the doctor may follow up the day after the surgery or 2 days after the surgery, then around the week mark, and then around a month mark. And if there are any complications in the interim, they may increase the frequency of visits. Doctors will always give you a heads up before the surgery, and they'll give you a handout information after the surgery for things to look out for, symptoms to pay attention to. And this is really important because while complications in cataract surgery are actually quite rare, they can happen and they can be really serious, like endophthalmitis, which is an infection inside of the eye. This needs to be treated immediately, or sometimes the eye may need to be removed. Now, I really don't want to scare anybody. This is very rare, and if you're keeping watch over things and you're using your drops as you should, it would be very unusual for this to happen. But all the same, you need to be aware of certain things so you can prevent complications along with your doctor. There are other post-operative instructions that your doctor will want you to follow. For example, sleeping in a certain position, wearing an eye shield while you sleep, or avoiding showering, or being very, very careful about getting water in your eye. And all of this is to protect the eye from any harm as it heals and to prevent infection. Recovering from cataract surgery itself is way better than it used to be even a few decades ago. Now cataract surgery is done in a way that there are almost always no sutures. Sometimes they're necessary, but for the most part, the wound is so small and the way that the incision is made, it closes up on its own. So the post-operative instructions aren't as intense as they used to be, and recovery is a little bit easier. In most cases, you'll want to mentally prepare for a few months of going through the cataract surgery pre-operative through post-operative process, and that's because most doctors choose to do surgery on only one eye at a time. And there are a lot of different reasons for this, but one of the big ones is that in case something does happen to the eye and there is a complication, the doctor is able to prepare ahead of time in order to try their very best to avoid that same complication happening in the second eye. Also, it allows you to go about your daily life a little bit better while having an eye shield on to protect the eye the day of the surgery, and only having one eye covered at night while you sleep, and to allow you to just focus on one eye at a time. But because of this, keep in mind that for most people, you're going to have surgery on one eye, then you're going to have a month or so of the post-operative drops, then you can switch on to the second eye and have a month or so of post-operative drops. Or in some cases, the doctor may do one eye, and then as you're going through the recovery, they may move on to the second eye about halfway through the post-operative period. It really depends, but just be mentally prepared that this can take a little bit of time. I hope this helps you to prepare for having a discussion about cataracts with your doctor and potentially cataract surgery. And I hope that it empowers you to ask any questions you may have of your doctor and to prepare for the post-operative process so you can have the best result possible. Remember, your doctor is there to help you and they have their staff there to help you, and they want the best out of your vision as well. So you really should feel as comfortable as possible approaching this surgery, and just don't forget to ask. Thank you so much for joining me, and I hope to see you next time, where we're going to be talking about those different lens implant options that your doctor may have, and how to avoid any pitfalls, and how to feel like you're making the right decision for you. See you next time.